Not all breast augmentation patients who come to us are straightforward. Most of them could be straightforward. A simple breast implant would do the job. However, some of our patients have a condition what's called as tuberous breasts, where the skin of the lower pole of the breast is very tight, and these are in several grades, a mild grade to a very severe grade. Now, a lot of times we get patients with very mild grades who come for a breast augmentation, and they ask us, is this a mild grade and can it be improved by a breast augmentation? Now, you must know that a breast implant can actually correct the mild tuberous breast. There is a technique which is called as scoring of the lower pole of the breast. Once the scoring is done, the implant automatically expands that lower pole, and they will be able to have a nice lower pole of the breast once the implants are put. So certainly for those patients who have a mild grade of tuberous breast, an implant is the way out. Some of our patients who also come for a breast augmentation, they also have a condition called as a sagging of the breast, and this usually is after losing a lot of weight, or it can also follow pregnancy. So once a lady has lost a lot of weight and after pregnancy, there is a sagging of the skin, and there is also deflation of the breast, and there is nothing sitting on the upper pole, and the patient would tell us that she is looking absolutely flat, and there is a descent of the nipple areolar complex, and the total shape is actually lost. Now, these patients who have sagging of the breast can actually get an improvement with a breast implant, or there are other treatments. Now, for a mild sag, which is a grade 1 ptosis, as it's called in our medical parlance, or a mild sagging of the breast, this can be addressed by a breast augmentation alone. So nothing else is required, just putting in the breast implant will actually correct the little bit of drop of the nipple areolar sag, and can actually give a nice natural feel to the breast. But however, when it comes to moderate to severe sag, you might have to do a technique which is called as augmentation mastopexy, where first the breast is actually lifted and before putting in the implant. So all this is done in one stage. So a patient with severe and moderate sagging of the breast may be helped, and implant which is placed in the breast, either into the breast or in the muscle below, that can help in volumizing the breast, also filling up the upper pole to sort out the problems of the sagging, and that can also help in correction of the excess breast which may be redundant in the lower aspect of the breast. So severe breast sagging, moderate breast sagging, a breast augmentation with a mastopexy will certainly help. Some of our patients, when they are in our consultation room, they like to have very natural looking results. They want to have the perfect slope, and they want to have the curvy lower pole shape to the breast. Now, this is possible by doing what is called as a natural breast augmentation. Now, you must understand that breast augmentation, it's all about the patient's measurements, what the patient's breast can actually take in. Now, a lot of surgeons might put in implants based on the wishes of the patient. So when you do that, there can be some complications, there can be a lot of stretch, the implant can get stretched out, there might be an extrusion problem, infections, all kinds of problems can happen when you put a oversized implant into a patient who cannot actually take the implant. So we do what is called as a natural breast augmentation, and this is based on the dimensional principle, where we take the measurements and go according to the measurements and giving a very natural look to the breast. Asymmetrical sagging breast is another problem, and this can be addressed by two techniques. One is by actually consulting the patient, what her expectations are and what she wants actually corrected. So what we do in such patients is we do a 3D consult, where we take pictures of the patient, we feed it into the software, and it kind of gives us what is to be done for each breast. Now, once we know that that particular breast can take up this much volume, so using probably different volume implants will actually correct this problem. And this can also be addressed by doing a donut mastopexy, where subtle amounts of breast sagging can also be corrected. But the trick over here is to choose implants of differing volumes so as to symmetrize both the breasts. When we consult our patients ask, especially when they come for a breast augmentation, they ask, what cup would I be? Now the rule is, for every 200 cc's of implant which you choose, the cup size increases by 1. So let's say if the patient has a 200 cc implant, and let's say she was a cup B, so the cup B becomes a cup C. Now if she goes for, let's say, 300, it becomes almost like a cup C, or maybe a little lower than that. So for doing a full C, she might have to go for almost 400 cc's implant if she were to go from A. So the standard thinking is that by putting in 200 cc's of implant, a patient will go 1 cup higher. There are patients which we get who ask us for oversized implants. Yes, especially when our patients are from the film industry, and when they have to do glamorous roles, they probably will want the cleavage to show, they'll want the upper pole to show because of the industry they are in. So these kind of patients, I mean, on special request, we do the implant sizing, and we put in the implants based on the dimensions, again not violating the principles, and especially when there's a lot of sag, that kind of breast can take in a larger volume of implant. So yes, if the dimensions, if the tissue characteristics of the patient permits, we would be able to use an oversized implant and still making the result look good. At times patients complain of dents in the augmented part of the breast. Now why this happens is because of folding of the implant. Now when you are doing the breast augmentation, when the surgeon is doing the breast augmentation, precise calculations, measurements are done to fit in the implant in the right sized pocket. But if one puts in an implant which is undersized, obviously the implant is going to fold, and this can cause a kind of a line or a dent which can show up on the skin. So it's all based on good principles of doing a breast augmentation based on the characteristics of the patient's chest, patient's skin, and this is called the dimensional concept, and this would actually provide a very, very natural results. So once we follow that dimensional principles of augmenting the breast, it's very difficult for us to create problems for the patient. So the patient must understand this concept that the breast implant is only there, only going to be good once it sits into the right pocket. We cannot be filling in oversized implants in an undersized measured breast.